Our organization spent a lot of time talking with people, with sectors, with partners who had lenses different from our own, particularly lenses informed by public health, by prevention, by housing access. And that changed us, it transformed us, and it moved us closer to where we are today, which is around a table full of many perspectives, many insights, many expertises that bring us closer to person-centered partnering and care. We want to move into even bigger tables with you, thinking about silos and silo busting, and the ways in which we can think about systems working together differently. Everyone who's joined this conversation this morning had choices about how to spend this morning, and you chose to be here, which means that you are not just willing to, but interested in working differently and thinking differently, and that is brave. And we are so grateful to partner with you in that context. In addition to thinking about system partnering and system interactions differently, we have to think about teamwork differently. We have to think about not just passing batons and screen and refer of people to resources that will help them meet their needs more quickly, but we have to think about how we relate to each other on teams differently and bring new kinds of humility to that work. An example of this is Dulce, a national model known as Developmental Understanding and Legal Collaboration for Everyone, on which MLPB was instrumental in the initial pilot that was trialed at Boston Medical Center and published in 2015. Through this model, there is tremendous silo busting happening across the country, particularly in California, Florida, and Vermont, but also in other states coming soon, some of which are represented on this call. This is a great example of systems change that intentionally aligns early childhood systems, pediatrics, clinics, and broader health systems, including ACOs, as well as the public interest law community, to converge and produce new ways of partnering with families around housing instability and beyond. And this is exactly the kind of work that we are excited to be part of with many of you and to build on going forward. To that end, we are excited to have released today a new report, Partnering with Families Experiencing Housing Instability, Considerations for Interdisciplinary Teams Based in Massachusetts and Beyond. We look forward to your feedback on the insights gleaned from a year-long Learning Community Special Initiative that was made possible by the Blue Cross Blue Shield of Massachusetts Foundation. And very excited to share with you here today colleagues in Massachusetts, which was the focus of this special initiative, but also colleagues in other states and across the country, a part of the report that is an initial blueprint for how to think about distilling critical know your community's rights information and critical know your role information for teams and workforce members who are critical to problem solving. In our conversation today with these wonderful experts who come from, again, national and regional perches, we are thinking with you and invite your comments on and questions about and challenges to an impact pyramid that we had the chance to partner with the Center for the Study of Social Policy on developing last fall. We are excited to be thinking with you about achieving impact not only with individual families at the household level, but also at the system change level, involving teams and organizations, transformation in practice and culture, and also policy change and related accountability. So keep these different levels of impact and participation in mind as we talk today, and we look forward to building on these themes with you in the future. If you want to learn more about the origin of the impact pyramid and how we think about it, check out this publication, which hyperlink is in the event program, which you've received through the press release. Want to say a special thank you to MLPB's partners as of May 2020. You are all early adopters in welcoming legal problem solving into your teams to improve your and strengthen your care delivery, your quality of partnering, and your family-centeredness. We are honored to work with you and so grateful that you are leading nationally in how legal partnering can be integrated into systems successfully and transform the kinds of levers that are in your toolboxes to support families. We're going to talk in a minute about Zoom orientation and etiquette, even though I suspect in this new landscape, many of us are spending more time on Zoom than we are asleep at night. That said, I just want to pause because our conversation today is not happening in a vacuum. It's happening in a new world order, or really a new world disorder, one that we know raises to the surface long existing challenges. When we talk about health equity, we can't do so without talking about health inequity. When we talk about race equity, we can't talk about that without talking about race inequity. And when we talk about economic inclusion, we can't do that without first talking about economic exclusion. There's a lot of talk about living in the COVID-19 new normal and the landscape. And I just want to acknowledge that there are people from all over the country on this call. And while we are all in this together, we are not all in this together in the exact same ways or with the exact same risks. And some of us have different degrees of separation and distance or proximity to loss, to grief, and to day in and day out life. So please know that COVID-19 related themes will be spotlighted today because this is the landscape that the families we all serve are living in and navigating. This is more than theory. This is life. And so as we talk today, whether it's our verbal conversation with panelists or your comments, questions, and challenges in the chat box, please keep in mind that this is not just about ideas. This is very much about people's lived experience, some of which involves loss and grief. Okay, back to Zoom. We really believe at MLPB that in this moment, there's a chance to lean into face-to-face contact, if not in-person contact. So join us on video if you're comfortable. Obviously, if you need to deal with childcare or a spilled coffee cup, we understand if you need to turn it off. Please do keep your audio on mute. Our moderators and panelists will unmute appropriately. We encourage you absolutely throughout to use chat to share comments and questions. Members of our team will be curating your questions for common themes and then feeding them to moderators later. Please know that if your question doesn't get asked or answered, we will be coming back to it in communication that we send out to all registrants afterwards. Finally, we invite reactions if you are so inclined to supplement your video participation, and we will be recording the event not only for internal quality assurance purposes, but also because we've already had so many people who have registered but can only participate for part of the event or who could not participate today ask if they could access a recording later. With that, I'm going to invite those who are active on social media to use these handles on Twitter and Facebook, and our hashtag is #UnlockingAccess. And I'm going to invite my colleague, Baraka Floyd, who has many important hats in the world of child health and health equity, to pick up the baton or the microphone, so to speak, and lead our first panel, which is focused on innovation at the household level. And I will now exit this screen share.
Thank you so much, Samantha. Good morning. I would love to introduce Allison Bovell-Ammon and Johanna Flax. Allison Bovell-Ammon is from Children's Health Watch, and Johanna Flax is from MLPB. I'm actually going to jump right in with both of these women into our panel today, just because we have so much to talk about. Allison, the scale of housing instability and homelessness across age ranges in our country is profound. What's unique about housing instability when it impacts families and children?
Yes, thank you for that question, and thank you so much for having me here this morning. There's been actually a lot of research and a growing body of research really around housing instability and homelessness and its impact on children and families. I do want to start by saying I think often when we think about housing issues, we tend to think about sort of what we at Children's Health Watch like to refer to as kind of the tip of the iceberg, and that is really around family homelessness and the issue that we can often see or sort of wrap our heads around as why that might be incredibly damaging for a child's health. The parent often is struggling with their own physical and mental health that's driven by the homelessness and the stress that that's causing, which of course impacts the child's health. But then there's also, of course, a lot of sort of depravity that comes with that situation, which impacts child health. But I think lesser discussed often, and what we have shown in our research and others have shown in their research, is that there's sort of a number of other housing conditions, housing stability conditions, from falling behind on rent to experiencing eviction, and the work that Matthew Desmond and his colleagues have done around how that impacts child health, to moving frequently and experiencing sort of this residential instability that families with children face. All of those factors impact child health. And so we were surprised. We published a paper back in 2018, Children's Health Watch did, where we looked at 3 forms of housing instability: families who were falling behind on rent, families who were moving frequently, and families who had a history of homelessness in the child's lifetime. And what we found was that 1 in 3 families with young children, families with children under the age of 4, had experienced at least one form of housing instability, and there wasn't a lot of overlap between those 3 categories. And then what also surprised us even more is that when we looked at each of those conditions separately, we found that in many cases, being behind on rent or moving frequently was as bad or worse for child health and parent health outcomes, including maternal depression, caregiver health, child health, hospitalizations, than homelessness. And so I think there's a lot of research around this, and I think it really begins to widen the conversation around how we think about adverse housing conditions and housing stability and its impact on health.
And then when you think about how housing insecurity and food insecurity interact, and you think about the negative impacts on health that food insecurity has, and you think about these children and families holistically, it really does amplify this emergency that we have when we think about the impacts on child health. Johanna, I know this is an area of interest for you. Do you have anything to add?
I think I'd amplify the good comments that Allison made about Matt Desmond's work to say, from the legal perspective, it's also not well known that having young children is a risk factor for being evicted. So it's counterintuitive, because I think many people are inclined to at least want to believe that there would be mercy shown to young children. And in fact, in a very harsh way, quite the opposite seems to be true in terms of the data on who gets evicted. It's also, in terms of focusing on related legal rights, it's a time when there is no universal right to education in early childhood. So you have parents who are more limited in their capacity to pursue employment and education themselves because they have caregiving responsibilities. Mm-hmm. The final framing point that I think is super relevant to what Allison is going to speak about more in terms of this housing prescriptions intervention is that work done by luminary pediatrician Jack Shonkoff has indicated that providing legal information, providing any information to parents in a vacuum is not that impactful on child cognitive development and academic readiness. But information in combination with coaching and with modeling is very impactful. And there isn't room for that kind of intervention when people are managing constant moving and the disruptions of homelessness. So that's why there's more at stake. And early childhood is a moment while there's more at stake, there's also more opportunity for interventions to be effective in the way that housing prescriptions has been.
So it needs to be within a supportive environment.
Right.
So that's a great segue. So Allison, can you describe housing prescriptions as healthcare for us?
Sure. So Housing Prescriptions as Healthcare was developed in partnership with a number of terrific organizations. I'm going to just share my screen very briefly just so that everyone can see the groups that really came around the table for this intervention. So Children's Health Watch, which is headquartered at Boston Medical Center, was sort of, we hosted the conversation, but I would say it was really a collaborative effort spurred by the Boston Foundation, who had this initiative called Health Starts at Home initiative, where they really started to ask the question, how can we think about the relationship and an intervention that not only stabilizes a family in their housing, but also has the potential to improve child health outcomes? And so we convened this group of partners, some from the housing community, like Nuestra Comunidad, which is a local community development corporation, Project Hope, which is a housing services agency, the Boston Housing Authority, with legal experts and healthcare providers like Boston Medical Center and MLPB to have this conversation around what would it take for developing an intervention that improves housing instability with the eye on improving health. And so what we designed was actually a research study that was a randomized control trial. So it meant that when we enrolled people, we recognized we didn't have enough resources given sort of the structure of the grant. And so it was sort of a lottery. And those who received the current standard of care received actually a little bit better than the current standard of care. We gave them a very curated list of resources in the community. But then those families who were in the intervention group received a suite of services. And we targeted this intervention to families who had at least one member who had some form of medical complexity. So that meant that someone, either a child or an adult in the family, was using a lot of emergency room services, or they had a child that required 2 or more pediatric subspecialists, so a child with multiple, often chronic conditions. And then we also targeted families who weren't just, as I mentioned, we wanted to sort of understand this scope of housing stability issues. So we, of course, recruited families who were homeless, but also families who were behind on rent, and therefore many of whom were at risk of eviction, who were moving frequently, or who were paying more than 50% of their rent or of their take-home income on rent or utilities. And so once they were in the intervention, they received care coordination that was focused on their housing-specific issues from our partners at Project Hope. They received financial counseling and benefit maximization services from Nuestra Comunidad. If they needed either legal advice, either the Project Hope team or others needed legal advice, Johanna was on our team to support them. And then if a family needed direct legal assistance, they were in a court-involved eviction, for example, they would be connected to a pro bono lawyer. And then we also worked with the Boston Housing Authority to not only have an application specialist that we paid for at BHA, who helped all of our families through the very complicated public housing application that requires many, many verifications and often needs a lot of support in completing. But BHA also granted us, through their permanent supportive housing waivers, priority on the public housing development wait lists. And so in doing so, we were able to provide this sort of wraparound set of services that then linked back. All of this was back in conversation with the medical providers who were referring these families and who were working on a number of other medical and educational issues that the families were experiencing.
So it sounds like what was key was having the housing authority at the table.
Yes, that was definitely key. I think we would not have been able to do this without leveraging existing housing resources. I think what's important to note about our study and about this work in general is that we as the healthcare provider did not pay for the housing. We identified ways to connect with public housing resources. And so I think it's incredibly important, and my colleague, Dr. Megan Sandel, says this all the time, is that if we're gonna continue to do housing and health work, then the federal government and our officials have to get back in the game of housing, because we as the health sector, as the legal sector, as the social service sector cannot solve this problem alone. We need big public investments in housing, and the way to scale up housing prescriptions is frankly to have more affordable housing available that we can tap into.
Johanna, you represented MLPB in this program. Can you talk a little bit more about your specific role and what you observed as part of this team?
With pleasure. And I just want to begin by saying hear to Allison's last comment and bringing Dr. Sandel into the room so her voice is heard loudly about the kind of partnership that's needed to move housing prescriptions from an idea that's available to some people to a reality where we can take for granted that people can have stable, healthy housing, and that does require a shift to move from what many of us have been hopeful for over a very long period of time, decades, to something that can be realized. And I feel optimistic in this moment, and I'm going to placehold that. And I'm going to come to my role and begin with saying that, as I mentioned earlier, accurate information about legal rights is essential if our goal is to stabilize people in housing that they have and assure that it's not subject to displacement through eviction or displacement because the conditions are unhealthy. And the process that makes housing prescriptions unique is the role that the care coordinator, in this case through Project Hope, played in being, forgive the reference to a sports metaphor, but the quarterback. Someone needed to be the quarterback. And in this case, the quarterback was someone who in many contexts is a community health worker by title. There are many other titles, but a person who is developing a relationship and working directly with the family to deploy many resources with the family that the family identifies as priorities. And accurate legal information is one of those. So my role was to be listening in structured meetings for potential legal risks and potential rights, and support developing an advocacy plan that would advance the family's goals. So that is the basic of what my role was, and I can speak more to details as the conversation unfolds.
You both spoke about how the shared database and data aggregation was one of the things that was a strength of this project. Could you talk a little bit more about how that worked?
Sure. So that was something we, as I mentioned, this was a research study, and I will definitely share some of our initial findings here in a moment as well. But we recognize that in order to be able to do the research, but also to be able to communicate across all of these systems, that we were going to need a shared platform where we would not only be able to track progress sort of in real time, so that those who were directly involved with the family would be able to connect and understand sort of who had when was the last contact, what happened, but also that we would be able to do the proper evaluation and data tracking that is necessary for these sorts of pilot programs. And so this was something we had a planning year for this project, which I would say I am incredibly grateful to the Boston Foundation for recognizing the need to plan these sorts of interventions and partnerships. That was invaluable to this project. And so during that planning year, we began to do a bit of a scan of what were the platforms that different programs were using, what was their sort of expectation around data collection. I think it's also important to note that there are real cultural differences across these different sectors and how they think about logging information, when that happens, who does it, how much detail, those sorts of things, but then also, of course, different data platforms. And so what we did is we had to set up data use agreements with every partner. We, of course, during the consent process, got specific consent from the family to share data, to share information across all of these partnerships. But then we also tried to identify a platform that wouldn't create a lot of burden, recognizing that everyone had to still log their information in their organizations, their own organization's data platform, but would be enough that we could still communicate with each other and we would be able to collect enough data to do our evaluation.
Mm-hmm.
And then, so one of the things that I noted about the findings of this study was mental health findings, so the improvements in anxiety and depression for the parents. Can you share a little bit more about that?
Sure. So we just published a paper, and it was linked in the agenda in Health Affairs, looking at the first 6 months of this intervention. And as I mentioned, this was a randomized control trial, so we were able to compare those in the intervention to those who did not receive the intervention, and in doing so, we're able to attribute these findings to the intervention itself. And so the three things we found within those first 6 months is that, as you mentioned, parent mental health improved, both anxiety and depression, as did child health. And I think what's important about this, and to Johanna's point about having the quarterback on the team, having a care coordinator, having a whole team wrapped around someone, I think that's what we saw as being particularly significant. It's important to note that at 6 months, the majority of the families in the intervention had not moved into a form of stable housing. They were still in a process of applying for a public housing unit. They may have still been in a process of avoiding an eviction. But what we saw and what parents reported to us qualitatively is that having someone on their team, having someone walk through this process with them to hear their concerns, really made a difference. They didn't feel so alone. The problems seemed now solvable. And that was a big aha moment for us, that even when we're not able to solve the problem immediately, just having someone in that family's corner, and that is the role of community health workers and the care coordinators and all of those people that really accompany families on these very difficult journeys.
Perfect. Thank you so much. And then we are open for questions now. The first question is, what was the size of the study population?
Yes, so we enrolled 78 families total, and then they were evenly divided by the control and the intervention.
One additional question. Johanna, in the new pandemic landscape with its far-reaching material hardship ripple effects, how might housing prescriptions need to adapt?
Well, I'm going to invoke Dr. Sandell again, who has said we can end family homelessness and housing poverty, and the federal government has to decide to. And so what she has emphasized is that we need to look at not changing this intervention, but seeing this intervention as brought to scale. So one way of thinking about that is to know, and this goes to a program that Children's Health Watch had also hosted recently, bringing in the National Low-Income Housing Coalition's director, Diane Yentl, is that when we look at populations in need of this sort of coordinated support, and I'm going to call it more is more support, but more is muddled if it's not structured. So what this intervention did is brought many players together who have been operating separately in support of families and catalyzed them through the structure of shared work on a database that was a real fail-safe for us and allowed us to look at many tendrils of need and respond to them in a timely way. So that doesn't need to change. That needs to be brought to scale. But we do need to look at some of the broader structures that are in the Health Affairs article articulated beautifully about what are some risk factors for people needing this kind of intervention. And one risk factor is network poverty, which was emphasized by Diane Yentl in some remarks at a Children's Health Watch event. Network poverty, meaning that it's not just the family itself that is without adequate resources to stabilize alone independently, but also in the kinship network, there isn't material support that can be brought to bear to buffer from risks. And so this kind of intervention, which calls upon Boston Housing Authority setting aside some resources in a supportive housing, affirmatively furthering fair housing kind of way, the Project Hope support in terms of a quarterback to coordinate care is what we need. And what might we look at to bring this to scale that would be a measure that could help us to focus? Well, one, again, looking at the Health Affairs article, is being aware of what's necessary from a place of equity. And we do know, coming to zoom in on COVID-19, that we are seeing impacts that are driven by racism, the history and the present tense of racism. So one measure we might look at in bringing to scale is if 13% of the population nationwide, African Americans, are representing 50% of homeless families. Are we bringing this program equitably and in appropriate numbers? Is it reaching nationwide people who are at risk and in need? And so I think that's the challenge, is not so much what needs to change, but what we need to focus on to bring it to scale equitably.
Thank you. All right. All right, I think we're ready to shift to our next panel.
Thank you, Baraka and Allison and Johanna. That was really fantastic and a really great setting to talk about the next topic. I'm Janine Castleman, everyone. I'm a legal advisor with MLPB, and I'm excited to have Brenda Clement, Director of Housing Works Rhode Island, and Sujin Conover and Yusuf Ali from Vital Village Network talk about how systems change impact housing stability for families with young children. And just a quick note, systems change can be a loaded term and there can be divergent meanings. And for the purposes of today's conversation, I'd like to use this as what we would refer at MLPB to the intentional human-centered evolutions in organizations and structures that have control or influence over lives of families and their ability to meet their goals and basic needs. And we definitely heard about that, how systems are impacting families in our previous panel, and now we'll have a different lens right now. So Brenda, let me start with you. And when we think about moving from people to populations, we need to consider different levers. And Brenda, can you share some examples of work your organization, Housing Works Rhode Island, is undertaking to transform systems that influence housing stability for Rhode Island-based families with young children?
So Janine and all the colleagues from Legal Partnership, thank you for the opportunity to join you today to talk about this issue. I joke with my housing colleagues all the time that I'll talk about housing whether I'm invited to or not. So thanks for inviting me to talk about this issue, and particularly to talk about the intersections between housing and health. I'm going to try to share my screen for a second so that you can see some of the complications that we've talked about. Sorry, I'm not sure if it's letting me do it. Hold on one second. No, unfortunately, it doesn't seem to want to cooperate today. Janine, I'm not sure if you can pull up the document that I sent if you have better luck, but as we well know, housing advocates like me say all the time that the path to economic opportunity begins at your front door. And I know I'm preaching to the choir here when I say that nothing works right in your life if you don't have that safe and decent place to get up from every day and to return to every evening. Particularly now with COVID, we know as more people are trying to shelter in place, that quality and condition of housing and affordability of housing and that ability to keep that roof over your head during this challenging time are growing need and growing concern for many families. And I think Janine has just posted, or is trying to post, just a picture of two kind of systems that exist within our world. The healthcare system, and this is just at the top of the page, a snapshot of existing programs and resources within Rhode Island state government. And there's more than within the healthcare system side of our state government and institution, there are more than 30 programs that affect the housing outcomes of Rhode Islanders. And on the bottom side of the picture is of the slide is kind of the housing delivery system in Rhode Island. And as you know, it's a mixture of both private and public, as is true in most cases. And you can see kind of the continuum of housing needs from market rate to long-term to supportive housing, the different types of housing, the different types of finances that you need in that system, the various partners and the various funding agencies. So by themselves, both those systems are very complicated systems and very difficult systems to navigate, as we all know from working in those spaces. In the local economy and to keep a job and to move further.
Okay, Brenda, I think we lost you for a moment, actually. So,
so I apologize. What was the last thing I said?
I think we missed a little bit of it, yeah.
So it just was talking about the screen that you were seeing about the complicated systems, obviously, that exist in both the healthcare setting and also the housing system. And so trying to get those two systems to work together and to coordinate together is part of what.
So Brenda, I think that what I'm going to do is I want to ask you to think about around how complex these two systems are and in supporting people around housing. And then in a few minutes, we'll come back and I would love for you to talk about how this looks different in a COVID-19 era. And now, what I will do is I'd love to ask, switch a little bit about how data sets are another kind of network with great influence over families' lives and capacity to make informed decisions. And data is neither universally accessible nor is it always gathered in ways that advance all interests. So Sujin, I was wondering, can you tell us about the origin of Vital Village's network community housing data tool? Why did Vital Village Network undertake this effort?
Sure. Hi, Janine and everyone. Thank you so much for having me. So the answering to your question, so community housing data tool, I will show you in a little bit, but it tends to provide information and resources to families and organizations who are interested in learning more about the state of housing in Boston communities. So it was first developed in a way to respond to the needs from the community. So several community members came forward and said, we need housing data to better understand inequitable housing situation in Boston. Vital Village Network has been working closely with the community members and partners for families and children's well-being. And we have shared various types of data through our data dashboard to promote equity and establish benchmarks for assessing the well-being of families and children, and use them to facilitate community engagement and accountability. After all, data is essential to telling a story about what is happening in our community, raising awareness, and making informed decisions. So we heard the needs from the community and created the housing data tool with the community. So the whole process was a participatory approach. So we have worked with the community data work group. It is a diverse team of community residents and community partner organizations. So they have provided a valuable direction in making the framework and identifying topics. And of course, here partnership is crucial, and most of our data is existing data either identified or shared by partners. So shout out to our partners. Some of them are here in this room: MLPB, Children's Health Watch, and Boston Public Health Commission, Breathe Easy team. Breathe Easy at Home team have been the part of this group, and we really appreciate the partnership. So by linking health and housing data in Boston area, this community housing data tool shares relevant data maps and resources with Boston families.
That's fantastic, and I'm really interested to explore a little bit some of the community-driven components of this work. And I'm wondering, Yusuf, if you can explain more about the Vital Village's core principles and how they carried over into the design and the development of the data tool.
Sure. Thank you also, Janine. So Vital Village is a network of residents, institutions, and organizations that are all coming together to maximize ways that we can focus on family and community well-being. So kind of like our core principles that we focus on is belonging, engaging, learning, and transforming. And that's very much focused in a community level. It's very community centered. So as Sujin mentioned, we were able to leverage the relationships within our network and a cross-sectional collaboration process to really access the qualitative and quantitative data that went into the tool. I think the parts of the community housing data tool that shows this the best is some of the lived experiences under the sections from single dads and returning citizens. And if there's enough time, I can talk a little bit more about it. As Sujin mentioned, we did have some really great partners that steered us in directions. But with this specific data set, there was no accessible data on affordable housing and how it affected single dads and returning citizens. We kind of found that it either just didn't exist or that people weren't able to share with us. So in order to address that gap in data, we engaged in a participatory data storytelling workshop with men from the community that have experienced housing insecurity as both fathers and as returning citizens. And we are using the term returning citizens as men that have spent time in prison and incarcerated and are just coming back home. So that's just the way that as a societal practice, we just use that because it shows the experience of the men and doesn't term them based on what their experience was. So this process really led to the elevation of stories that haven't been told and data that hasn't been shared, and just a way to get those resources and opportunities into different parts of the community that come directly from men and fathers that have experienced it themselves. And what our goal is and what we're doing is to use their stories that they told to create a video, and it goes into a video narrative that will go on the housing tool under those both sections. And that will kind of help work towards informing advocacy towards policy and other community efforts to just have a more balance across the community.
I think this is really exciting work to have the data design being driven by community members who may not have been given platform and voices to express the need and desire for the different systems that they've interacted to have their experience be reflected in how the data is being collected and driven. And just so I think everyone's probably quite tantalized about whether or not what this tool will look like, we will actually demonstrate the tool in a minute. But Yusuf, before we get there, just so to round out some of the design process, I know that MLPB was delighted and honored to be part of that contribution to the design process. So can you tell me, how did legal expertise help advance some of the group's goals?
Yeah, I think early on in this process, we realized that it would really take a collective impact approach towards supporting this type of system change to really get deeper collaboration into some areas that we weren't able to access. So pretty much just to give a quick process of how it went, after the initial process, when we were able to engage with community members, we were able to get some data and some really specific issues that community members wanted to talk about, but we just didn't have a way to put it together. And the design of it just wasn't there. It was really just a list of, these are important issues that are happening a lot across the communities within specifically like South Bend, Roxbury, Dorchester, Mattapan. We were hearing a lot from the community members. So Johanna Flax of MLPB provided us with some guidance in the design of a grid tool to kind of help some of those issues and topics that we were coming up, to really see them along the process of a grid of areas that weren't just these random things, but also to kind of look at them in a way that they had providing both quality and safe resources. So kind of giving us that mindset. In addition, there was also some really great strategic partnership that was suggested, just as people that, knowing that everyone doesn't have the answers, but just there are people that might have answers that we weren't able to get. So Johanna really helped us in that direction of finding people that had additional information in additional data fields. So some of that legal advocacy and preventative legal resources were specifically in the area of like evictions and like safe housing conditions. And Sujin will be able to go into more of it when she demos.
Sujin, why don't you go ahead and start getting your screen share ready? I'm really struck by, so far, a lot of the work people are doing is interdisciplinary, right? Bringing all those different perspectives to sort of advance and deepen the understanding of problem and solution. And so I'm excited to see, to have Sujin demonstrate how particularly their tool has been used and it's accessible for anyone on this call to use as well.
Sure.
So take it away.
Can you see my screen?
I can see your screen.
Cool. I can show you the community housing data too briefly because we don't have too much time, but here there are data maps and resource pages in 4 different categories of support systems. So in the topic of community external quality and safety, we have 2 different data and also 1 resource page are shared here. And in-house quality and safety topic shares blood lead levels and smoking prevalence data maps across the city of Boston. And then for the topic of accessibility of affordable living options, we are sharing severe winter burden across the city of Boston. And then for the stability support topic, we're sharing eviction rate and how inequity issues can be popped out geographically across the city of Boston is shared here. And then we also are sharing eviction-related resources on this page. And these three focus group population groups, as Yusuf mentioned before, these are the groups identified by the community data work group, and then the lived experiences from these groups. We're in the process of production of narratives. So these spaces will be the place that we will share those stories from the community as a qualitative data. So let's take a look at one page here. So this data map shows distribution of needle pickup requests to the city of Boston. Oh. Okay. And then this data is a relatively unconventional housing data, but it illustrates a critical community safety issue, particularly for children. So children can be pricked by discarded needles in playground, parks, near school during recess, or on the sidewalk outside of their home. So community members who are very concerned about this issue and wanted to see data to scope the problem. So in this data map, you see the darker areas here. These are the areas showing the concentration of disposed needle reporting and along the Massachusetts Avenue here. So, and also, if you click this button, you can actually place your address here, and then you can see where you are in the map. And then if you are a parent, you can actually look up the kids to school as well. So these pink dots are the schools, and then if you click one of those, you can see what school is here. So Vital Village Network members are using this community housing data tool to lift up the community voices and to raise awareness. And we also shared this tool with the community members in Urban College Advocacy Certificate Program so that they can use this data tool and other pages for their community advocacy projects. So we don't really have too much time to explore other pages, but please feel free to visit our tool and explore more data. And then also we are using mobile-friendly platform as well, so you can easily navigate and explore more easily on your mobile phone. So I can stop share here.
Yes, Sujan, I just want to say, first of all, thank you so much for sharing that and doing a demonstration. If anybody is interested in exploring this more deeply, the link to the Vital Village tool is available in our chat. I just wanted to say that your map that you particularly showed, I found that really fascinating as someone who's worked around poor conditions, things like lead and other things. Like, that information is super valuable, but to hear that needle safety was also a community-driven need, that there was insufficient data, is really incredibly useful. It's something I, as a parent, would want to know about 100%. So I really find this is like an amazing lifting of what the community knows is to be a problem, and also to create the data for people to say from a systems level why this matters and where we would next go for addressing maybe some of the causes for the needle safety issues. I noticed that there's a couple questions that came up into the chat, and I know that there's been some answering, but perhaps we could just look that so that anyone on the call who can't see the chat may also hear the question. And I'm just going to give me a second to scroll down to that question we got. There was a question about, did you get the community's, the full comment was kudos to the fact that CPRR was implemented in this research. Did you get the community's input via focus groups? Also curious about what they identified as worth as exploring. And I know Yusuf, you answered in the chat, but for posterity of the recording, would you go ahead?
Sure. Just wanted to make sure that we did share that it was a combination of those things that was asked. So it was a combination of engaging community members through focus groups that grew into work groups. We were able to engage those work groups fairly often throughout the year as needed, and also just communication back and forth that was really helpful. And then also one-on-one meetings with community members really helped, just because some people were more comfortable sharing in a one-on-one process, and then allowing us the freedom to take that information and then really work with it more.
Thank you for that. And I also just want to make sure that everyone knows that Housing Works Rhode Island puts out an incredibly valuable resource for Rhode Islanders. And I'm going to, Brenda has noted it in the chat, but I actually love this book so much it actually always stays on my desk so I can Vanna White it for everybody. But it's not just data about affordability and the household income of a particular town. It really explores how transportation and education are impacted by housing systems. And Brenda, if you wanted to have the last word, I really would love for us to think about how systems work, how the data that we're seeing from Vital Village, how the data we're seeing from Housing Works Rhode Island is going to be part of how we then respond to what we know is coming with a COVID-19 recovery, economic recovery component. So I'd love for you to take us out on that, if you have, if you are able to chat. And Brenda, that's not possible. I would love for Sujin and Yusuf also. I know I'm throwing this as a curveball question to you two, but if there's some way you're thinking about now with this work, how this will inform working with the community going forward, I think it'd be a great final question.
So, hi, this is Brenda.
Oh, you are there. You are there. Yeah, okay, go ahead, Brenda.
Sorry about that. I'm not sure what's going on with my internet connection today, but just definitely not cooperating. But in any case, as on our setup call, the project, the Vital Village project, is definitely interesting. It's something that we want to try to replicate in Rhode Island. But I think part of what I got cut off on when I first got kicked off the call due to my internet issues, where I was talking a little bit about our Alliance for Healthy Homes project, which has been a project that we've been working for several years, where we tried to bring all together all of the partners, state agencies, health providers, energy efficiency programs, other programs that all deal with the quality and condition of housing programs together to try to share information and share data. We've been working with a consultant to utilize a tool called One Touch, which again is trying to share across systems and share data across systems as home.
So Brenda, I know that there's still some technical difficulties that you're experiencing, but I just want to note that the One Touch tool is used often by home visitors who are going into homes, usually through programs that involve young children, and that home visitors would see issues that would require support among other domains that impact housing security, and so. Rhode Island Alliance for Healthy Homes is a big part of thinking about how we address housing stability in Rhode Island, especially as we consider the impacts on young children. Brenda, thank you so much. Sujin, thank you so much. Yusuf, thank you so much.
Thank you.
And I would love to then turn the baton over so that we can then move on to our third panel. Thank you.
Thank you so much. We're going to have to start calling these mini panels or micro panels, but what a lot of great sharing so far. And I'll just, as we welcome Emily, Christina, and Solin to this next round of dialogue, I just want to take moderator's privilege and punctuate, I think, a key theme from this last dialogue, which is that when we think about system change, the data sets that are generated, curated, and disseminated are critical to actually tailoring responses and strategies that are meaningful for populations and subpopulations like families with young children. And so really appreciate what Vital Village Network is doing, what Housing Works Rhode Island is doing to be thoughtful about what goes into the creation of data sets and who is part of that and then how those data sets evolve over time. So against that backdrop, and thank you so much, Franny, for putting up the slides so that our wonderful panelists in the policy change section can be introduced. I'm delighted to welcome Emily Benfer, Cristina Contreras-Fox, and Salan Vargas to have a conversation that brings us to the base of the pyramid, the base of the impact pyramid that I shared when I welcomed everyone earlier today. And I want to start by a brief dialogue with Salan before engaging Emily and Cristina next, because the theme of race-based disparities and race-based inequities really came up during the first panel at the household level and thinking about disparate impacts relating to housing instability and also disparate impacts health and materially wise in terms of COVID-19. And Salan, you played a leadership role in the Obama administration's issuance of an important new regulation in 2015. Colleagues on the Zoom, this is an important piece of background, so forgive the preface that paragraph preface that I'm giving Salan in this question. The rule was intended to implement the affirmatively furthering fair housing requirements of the 1968 Fair Housing Act, which is pretty important civil rights legislation in our country's history. For short, we're going to call affirmatively furthering fair housing the rule AFFH. Say that 3 times fast. The opening text of the final rule states its purpose: to provide program participants, which in this case are not human beings or families, but are cities, counties, states, and public housing agencies, with an effective planning approach to aid them in taking meaningful actions to overcome historic patterns of segregation, promote fair housing choice, and foster inclusive communities that are free from discrimination. Fundamentally, the AFFH rule was a new lever to strengthen longstanding civil rights protections that had lagged in translating into equity, advancement, and opportunity building. So Salan, against that backdrop of demystifying AFFH for our colleagues, what, as a technical matter, because you were part of the policymaking team, what specific aspects of AAFH were you most confident would catalyze broader equity in housing and neighborhoods? And then, just as a preview, feel free to move past the technical perspective and tell us a little bit about what you learned or what you observed about how hard this was going to be.
Well, good morning, everyone, and it's great to be with you. I feel in the first part of the panel that there are lots of brothers and sisters and comrades that have been working in this kind of similar space. Thank you, Samantha, for the preface and the introduction. It feels like ages ago that any and all of us were working on, firmly furthering fair housing rule, and it's years ago now. To the question, Samantha, that you asked, I'll break it up in a couple of parts, and I know I have to speak quickly here because we don't have a lot of time. Each stage of the rulemaking process, and just remember what Samantha said, and for all of you who know this and others that this may be a refresher, this goes back to 1968. And so there were folks during 2008, 2009, 10, and beyond who were thinking that the Obama administration had made this up. It wasn't made up. It was on the books. It's been on the books since 1968 as part of key civil rights legislation back then. But each stage of the rulemaking process, to be fair, had its defenders and detractors. So I know you asked about what I was most confident in, but let me say that confidently. There were folks who, both within the administration and outside of the administration, who defended the steps that we were taking and who were detractors. What gave me confidence is that in some of the early beta testing of the rule that we did, and for Sujin and others who showed other tools, there were some recollecting of similar approaches that we were taking. We, in some of the early beta testing, we took a kind of what I call the 3Ds approach. We were thinking about data and tools that communities needed to have. We were also thinking about what it would mean to deliberate on the data. And then lastly, through data and deliberation, how might those two pieces actually inform decision-making? And so we thought comprehensively around the approaches. That increased my confidence level. But here's the big caveat. And I think it's a caveat that we all have to wrestle through as we see some of the tools that are here. Knowing doesn't substitute for political will when we are speaking about racial equity. And so there were those of us who took heightened levels of rationality. As long as we actually put data out there, put tools out there, put knowledge out there, it would increase people's confidence level. We would be able to make the right kinds of decisions related to dismantling kind of racial segregation and discrimination. And so, you know, other things that gave me confidence were that we sequenced much of the planning work. So the planning work would precede a lot of the investment decisions with consolidated plan, with public housing plan, and we've heard references to those pieces of work. So comprehensive approaches that were put forward, sequencing decisions that I think gave us confidence that we would do, community engagement approaches that I think gave us confidence that it would actually end up working well. And I know, Samantha, you've asked me to kind of bridge to some of the lessons. Maybe I'll go to some of those lessons.
Please.
And some may remember this again from right around 2012, 13, 14, right around that time period. In summer of 2015 is when we announced the final rule. For the year prior to the final rule, as in federal rulemaking, all of us who understand and have experience with this, there's a public comment period. And as so many of us have talked about publicly, and remember, this is 2015, that public comment period, go ahead, I'm sorry.
I think just a reminder, everyone, to please mute yourselves. Please continue, Salin.
The public comment period and the public comments, thousands upon thousands of comments that came in the months prior, 3/4 of the comments on the affirmatively furthering fair housing proposed rule were pure racist screed. And it revealed that summer for us in the administration that deep, dark underbelly that Samantha, you've talked about, that all of us have talked about and all of us actually know. And obviously during 2016, surfaced in lots of ways during the election time. And so, you know, right after the 2016 election, I was, the irony of this is amazing. And I was thinking about this, Samantha. I was in speaking at this Truth, Racial Healing and Transformation Initiative in California. And it was the same week that Secretary Carson had gotten nominated. And for those who remember this, about the only thing that he commented on publicly about housing was on the AFFH rule. And he said that it was social engineering and that it's illegitimate for the federal government to actually take those kinds of steps. So, you know, we learned lots of lessons, again, around data, around the provision of data, around heightening the levels of rationality. But as I mentioned before, the kind of political context of what it means to take steps on racial equity issues, we learned so much more about. Let me just pause there.
Salin, thank you so much. And thank you for sharing that critical frontline view from such an important place in policymaking in our country and in our country's history. You've also spotlighted for us how when we get to the base of the pyramid, we talk about policy, we can't not talk about politics, political will, and some other variations on that theme, although we're going to be careful because we're a nonprofit. So all this to say, thank you so much for bearing witness in the way that you have done in so many ways. And now I'm going to ask you, because 5 years ago feels like a long time, but actually is yesterday in ways that are important for all of us to keep in mind. You have moved on to new or evolutions in your important work, including serving as founding director of the Mixed Income Strategic Alliance, which I know is thinking deeply about future-oriented design of neighborhoods that are intended for all. Can you say a little bit about what sort of key priorities are right now for the Alliance and how that is linking up with policy efforts?
Sure. Thanks, Samantha. And again, I'll try to do this fast. I think all of us on the line increasingly over the last decade or so have heard so much spoken about around the importance of zip code beyond genetic code. And for those of us who worked, and all of us who've worked on kind of place-based work, importance of housing and thinking about communities and the context in which families and children are living, we and now have this kind of full appreciation. And I'm going to use some words that we used before and phrases that we used before. I think that Johanna had mentioned kind of network poverty, context beyond family and household and housing unit. So I think all of us understand that it's, from family to housing to broader community, there are layers of context that we have to think about. And so in the Mixed Income Strategic Alliance, we have our sight line on how do we create the context for equitable, inclusive, diverse, mixed income communities. It is a strategy in the country that's been around for a couple of decades now. For those who remember the early Hope 6 days with public housing transformations, this dates back to that period and beyond. And so, and for those of you in Boston, many of you who are in Boston know the work of Raj Chetty and what he has been able in his data to show around the importance of place and the context of place. For us in the Mixed Income Strategic Alliance, Samantha and all, it's more than a physical transformation strategy. It is a focus on the social determinants of health, what it means to create high quality schools, access to fresh food, early childhood access that's critical, healthcare access that's critical. So they are essentially comprehensive kind of cross-silo partnerships that have that are being built. There are several hundred of these intentional mixed income transformation projects around the country that increasingly we know certain things about, and I'll mention a couple of them. And then I'll mention a couple of data points in the COVID era that are really important coming from these communities.
Actually, I'm going to stop you after the first thing you share. Just
okay.
Okay, thank you.
We'll do that.
In
that part, what I will say is we have learned, unsurprisingly to those of on the line, that easier to do the physical transformation, to make these places look of quality and new and wonderful physically. We've actually made quite a bit of progress in the country in creating the physical units. The human capital dimensions of the work have been more elusive for the field. And so in the Mixed Income Strategic Alliance, we have our sight line on being very human-centric and really claiming that if we just change the physical environment and don't really address the human capital dimensions and challenges that are even heightened during COVID-19, we're going to fail. And so that's where we have our sight line on.
Thank you for that critical laser-like sightline, which you invoke human capital, and I will also extend into culture change as food for thought for everyone. And on that note, we're going to double back to what is very practical and high stakes for families with children living across this country, but especially in Massachusetts and Rhode Island right now, and ways in which our next two speakers are contributing, again, in very concrete, practical, and scalable ways to solutions in an environment where, to use Salin's word, solutions seem elusive. So I'd like to welcome Emily Benfer from Columbia Law School, who is a valued, long-standing MLP community colleague and one of the nation's foremost legal experts on housing law, particularly as it relates to the health of human beings. And Emily, as a national leader in efforts to score, and I mean grade or mark, or measure housing law and policy, and to lift all boats in the process, we hope. I have a few questions for you,
Great.
which
Thank you.
I know are going to inspire not just big picture thinking, but also some concrete steps in action. Can you summarize for our breakfast community this morning the most important trends that you're seeing in terms of eviction moratoriums around the country?
Thank you. And thank you so much for having me with this important group. It looks like I am unmuted. Great. Okay, so we know that unemployment levels are surpassing Great Depression levels. And because of that, we can expect to see families hard pressed to make ends meet. In fact, we've seen that call centers across the country are receiving a 92% increase in daily rental assistance requests from prior years. And the demand at food banks has also skyrocketed in recent weeks, increasing as much as 600% in some states. So we know that, like before, the rent eats first during a pandemic. Yet we do not have a national moratorium on evictions, and the renter protections we do have vary widely in strength, duration, and breadth. While we do have a CARES Act that placed a moratorium on evictions in federally assisted housing and units with federally backed mortgages, only 6 states require landlords to certify that their unit is exempt from the moratorium before filing to evict a tenant. And the majority of tenants are not covered by the CARES Act. So with a team of law students, I analyzed hundreds of eviction moratorium documents nationwide and thousands in state, and partnered with the Eviction Lab to create a housing policy scorecard. I'm going to drop the links to that, to both the data set and the scorecard in the chat box. And
Great.
in the meantime, I want to show you a map to give you a sense of what we're looking at nationwide. So here's what we found. This is a Washington Post map that demonstrates the scores and the inconsistency of eviction protections across the country. So here's the data. 23 states have little to no eviction protections, and that covers 31 million renters. 9 states have no eviction moratorium whatsoever. 25 have instituted foreclosure moratoriums. 71% of states allow the landlord to give notice to the tenant of eviction, and we know that many tenants will act on that even if there's protections in the state otherwise. Half of the states allow landlords to file an eviction. 45% of states allow courts to hear eviction cases, and that's happening remotely, which raises a whole host of issues about basic civil rights and due process rights. 60% of states allow sheriffs to enforce orders of eviction that have already been issued. And 16 states are or about to be holding eviction hearings by phone, which is diminishing those basic rights. I can give you an overview of what's happening locally as well, if that's helpful.
Please, please.
Massachusetts is actually one of the leading states. So this is a snapshot of the scorecard. If you go to the scorecard website, you can get detailed information about what's happening in each state. And it's broken up by the 3 categories of eviction moratoriums. The first is controlling the landlord, so the initiation of eviction. The second is controlling the court process by stalling or freezing hearings. And the final is controlling the sheriff by preventing execution of eviction orders. So Massachusetts passed model legislation last month that freezes all phases of eviction. And this is important because we know that the mere filing of an eviction results in a scarlet E that drops credit scores and impacts housing options for individuals. Massachusetts also included short-term supports. You can see that they extended the deadline past the emergency declaration for the moratorium. They also forestalled utility disconnection, and they instituted a foreclosure moratorium. And finally, which really elevates them into this model realm, they added housing stabilization measures by including $5 million in the pre-existing residential assistance for families in transition RAFT program to provide up to $4,000 in rental assistance for households affected by COVID-19 crisis. And they can keep using that vehicle as the stimulus funds come through, and advocates are hoping to increase the amount that's set aside for rental assistance. I know that we also have some Rhode Island folks on this call, so I thought I'd share that with you as well, if I can figure out how to get there.
It's all good. It's all good. This is wonderful. Thank you.
It just, oh, here we go. But I didn't change the top. Here, I'll do that for you right now. There you go. Okay, so now we're accurate. So Rhode Island. Rhode Island is on the other end of the spectrum. They rounded out at about 2 stars on our scorecard because their eviction moratorium is largely in the emergency health response. It's based in the courts, that it prohibits filing and hearings on eviction, and it ends on May 17th. So while the Rhode Island Supreme Court has frozen new evictions and filings in the court process, it has not implemented any statewide order to address rental debt that might accrue during the pandemic. And without more supportive measures in place, without extending that moratorium much further into the future, Rhode Island could see a surge of evictions soon after the emergency expires.
Emily, thank you. Few people in our country have the lens that you do that is as broad and as deep at the same time. We have talked in the past about the unique risks confronting tenants that are families with young children, risks that relate to lead exposure, which we know has such lifelong and profound, can have such lifelong profound consequences for humans. We've talked about what epidemiologists in the COVID-19 landscape are calling sort of super spreader, children as super spreaders in this environment. Again, not loving all of the language, but I'm just putting it in the epidemiological context. Against that backdrop, Emily, I know you have specific recommendations on how states and the federal government can help solve these profound and urgent risks to family health and well-being when it comes to housing right now. Can you summarize your top recommendations?
Yes, and I think some of these are really rooted in the unique risks that are confronting tenants with young children, especially in the low-income setting, because they are often confined to homes that have poor air quality, mold, lead hazards, pest infestations. And so for the 35 million or 40% of homes in metropolitan areas that have one or more health and safety risks, the tenants are at higher risk of complications for COVID-19. So how do we solve these problems? Well, first and foremost, we need to make sure that people have safe and decent housing to shelter in place in. And the public health emergency response must require a nationwide eviction and foreclosure moratorium that goes well beyond the extent of the pandemic so that we have time to stabilize families and ensure that we don't have this downward slope to homelessness and destabilization. We also need to meet people where they are. We should be screening children and families for COVID-19 and lead poisoning and other health harms that they might be experiencing at home at the food banks that they're going to, at the grocery stores and in their communities. And we can do that while maintaining social distancing, but we know we need to go into the community. We can also layer on to the structures that we already have. With the right partnerships, telemedicine can be used to identify the most dangerous health hazards in a home, from severely chipping paint to asthma-inducing mold, and it can also be used to prescribe alternative safe housing. We must ensure access to justice. We know that we will see an increase in evictions, and without an attorney present, remote hearings, let alone regular eviction hearings, jeopardize constitutional rights, and they increase the imbalance of injustice in a system that's already skewed heavily toward property owners. So if we're going to prevent further backsliding, we really need to institute a civil Gideon nationwide.
All right, I'm sorry, Emily. I really apologize. Go ahead. Let me let you wrap up. Yep. Someone will do civil Gideon in the chat. Mm-hmm.
Oh, good. Okay, so two last points, and then there's so many more to talk about, but just to plant a seed, we really have to secure federal and state support for rent relief and long-term affordable and fair housing. The HEROES Act was introduced yesterday, which would institute $175 billion in rental assistance and for homeowners, and 10,000 emergency vouchers, as well as a 12-month eviction moratorium. We want to see more of this, and we need to support it on the ground. And then finally, band with your community. Nonprofits, churches, hospitals are all critical to housing stability. And we've seen that in Massachusetts through community land trusts in Roxbury and hospitals in the Boston area creating innovative, stable housing initiatives. So really using those resources, we can ultimately eliminate eviction as a social policy and replace it with the right to safe and decent housing.
Emily, thank you. And here for recording these kinds of sessions. Now, Christina Contreras-Fox, you might be thinking, MLPB has shortchanged me as a panelist because we have 5 minutes left.
Oh, no.
Au
I would
contraire, you are being given functionally the last word, which is more than earned by your outstanding policy work in the Ocean State. Folks are going to get to know you through your bio in the program, and I see people are already reaching out to you to join you in mobilizing efforts.
Yes,
Christina,
please join us at Homes RI. Great
Woo!
table of advocates that are fighting to prevent eviction, to work on, we have a shared agenda of housing justice, and we want you to be a part of it. So thanks for letting me plug Homes RI.
Oh, Christina, thank you for being here. Thank you for rolling with this unusual last word moment. And rest assured, we're going to have a lot of everybody back, because clearly we have a lot to talk about and there's a lot of great information to share. Can you talk about the centrality of people's lived experience in the way that you and your organization approach programmatic policy and advocacy efforts? And then I'm going to ask you, sort of a targeted question about your response in this COVID-19 moment.
Absolutely. So I work for the Rhode Island Coalition for the Homeless. We're a dynamic coalition that works to advance lasting solutions that prevent and end homelessness in Rhode Island. Now, we don't provide direct service through the coalition like shelter or permanent supportive housing, but we do have in our coalition pretty much all of the shelter and supportive service providers in the state, and we anchor a lot of those systems. Excuse me. So our 4 main areas of work are policy and advocacy, constituent engagement, systems transformation, and then training and support for our service providers. And I won't go into all of our guiding principles, but one of those guiding principles that I think is most salient here is that this work that we do will always be informed, not just by data, but by lived experience. We need to make sure that these solutions that we're advancing and that we're creating are centered in what Rhode Islanders experiencing homelessness and housing instability really need. And nobody understands that better than those folks themselves. Like, no one understands where a policy falls short, where a policy fails, and what it can be, where it can be improved better than the person who's going through it. And so particularly, and I'm going to speak more to our policy and advocacy, because as the policy analyst and the lobbyist, that's my lane. But we really seek to be the bridge between people who are impacted by policy and people who are making policy. I mean, ideally, those would be the same folks, but unfortunately, that's not how our power structures work right now, although that is changing. But we need to make sure that people who are making policy aren't doing it in a vacuum, because that only furthers inequity, that only furthers people suffering, that only furthers all of these terrible things that our neighbors experiencing homelessness are going through. Excuse me. And so to that end, we've created, one of our big projects is called Voices of Homelessness. It's a speakers bureau, and it's comprised of Rhode Islanders, a diverse group of Rhode Islanders who each have a lived experience of homelessness and who share their story to educate people on what homelessness is, how it happens, what it's actually like to experience it, what it's like to try to get your housing back, what it's like to try to get back to stability in your housing, et cetera, after you've gone through the trauma of experiencing homelessness or while you're going through it. And also to advocate, they share their story to educate, but also to advocate where the change is needed to prevent and end homelessness in Rhode Island. They're an incredible group of folks, and their stories have a lot of common threads, but they're all very, very unique. But one thing I'm really struck by, every single one of them, every single member of Voices of Homelessness is not only somebody who's experienced homelessness, but is now volunteering and finding ways to help and support people who are experiencing it now. So all of them are outreach workers, peer-to-peer navigators. They, excuse me, they do so much work back into the community, and it's incredible to work with them, and it's incredible to be able to amplify those voices. And we, when I'm up at the State House talking with legislators, they are with me, sharing their story, talking with legislators, testifying when there are decisions to be made. Like, for example, with the first CARES Act that was passed last month. Oh no, wait, we're in May now. Sorry, all the months are blending together. First CARES Act was passed in March. The state got a lot of funding coming in from that, whether it was the Coronavirus Relief Fund or ESG or CDBG. And so we convened input groups of folks to pass that input along to our Office of Housing and Community Development to say, look, we have these funds that are coming in. You've asked us how these funds can best be used to support people experiencing homelessness. Like, we're not going to speak for them because they can speak for themselves, and here's what they have to say. And can you show us now how you're going to abide by the recommendations or really the needs that they've told you about in the community? And we tried to make that be a part of all of the work that we do. But really, for me, I think that's so important when it comes to policy and advocacy, because again, if you are not, if your policy proposals and if your advocacy is not centered in what people actually need and is not led by them, then you're making policy in a vacuum, and you're advocating for things that might not ultimately help anybody. And the stakes are just far too high. I mean, we're talking about people's lives, families' lives and livelihoods. The stakes are just far too high to do that.
Christina, I can't imagine a better place to sort of put an exclamation mark, acknowledge that it's 11:02, acknowledge that moderator's privilege aside, now it's host privilege. We're going to 11:05. I know we're losing people, but it's too important to not let Christina take us to the next place, which is kind of home. And then to close out with just quick reflections and previews of next steps. Christina, thank you for that lovely description of how principles feed into practices in your work. Can you tell us now, based on that approach, what are the priorities, policy priorities that you're participating in right now to help to advance, to partner with in promoting health and stability for families with young children right now, especially when it comes to housing and homelessness?
Happily. So there's a lot that I could talk about here, but I'm going to center my remarks on the HEROES Act, which is the stimulus package that was introduced yesterday by Speaker Pelosi. It's something that to give a little bit of context, I mean, if you're in Rhode Island, our General Assembly hasn't met since the beginning of March. So a lot of usually our advocacy and policy work focuses on the state level, but since that's not happening right now, we've really centered and focused on federal advocacy and making sure that funds are coming into the state from the federal government, because with an $800 million budget deficit, we know that we can't really look for we're not going to get the resources that we need from state coffers. So federal advocacy is key. Now, one of the things that we really have pushed for, so I should take a step back. In the HEROES Act, this next stimulus package, we have three main priorities that we've been advocating for, along with our partners at the National Low Income Housing Coalition and the National Alliance to End Homelessness. And they are $11.5 billion in emergency solutions grants, $100 billion in emergency rental assistance, and a national uniform moratorium on eviction and foreclosure. And we also advocated very strongly for the Emergency Rental Assistance and Rental Market Stabilization Act, which is also that $100 billion fund in rental assistance, which made it into the HEROES bill, which is really important. Because if we are going to prevent, this wave of this wave of evictions that's going to hit our state after the moratorium lifts on the 17th is real. And it is a crisis is a crisis waiting to happen. And it was already a crisis before this even started. Excuse me, I got a frog in my throat.
Okay.
But we know that rental assistance is going to be vital to be able to help Rhode Islanders stay in their homes and keep their housing. In particular, when you look at the impact, to come back from the impact of this pandemic on our communities. So this is, for me, a racial equity issue, because 46% of all coronavirus cases, 46% of all Rhode Islanders who have tested positive are Latinx. And this is an issue that really hits home for me because I'm first generation Guatemalan American. My brother was one of those cases. He is fine now, he is healthy now, thank God. But this is the same can't be said for so many folks in our community. So nearly half of all COVID cases are Latinx Rhode Islanders, and over 75% of Latinx Rhode Islanders are renters. So if we are not providing them the resources that they need to be able to maintain their housing, we are not doing what we need to do to end and prevent homelessness in Rhode Island. So we pushed very, very hard for that rental assistance fund. Really pleased to see it in the CARES Act. Really glad that our entire federal delegation has co-sponsored the Emergency Rental Assistance and Rental Market Stabilization Bill. Because this is, just like I said, so important. And the other thing that I want to mention here is, you know, all of these issues that we are dealing with, they're not new, right? Like this was a problem before. You know, COVID has not been the great equalizer. Non-homelessness is also not the great equalizer either, as I've heard it described. I mean, Black and brown communities nationally, but especially here in Rhode Island, the disparity that exists is enormous. You know, just to give some data for perspective, so I mentioned that, you know, half of all Latinx, half of all cases, COVID cases have been in the Latinx community. I asked our HMIS team to pull some data about, centered on families experiencing homelessness who presented to the shelter system, who called coordinated entry to get resources to find shelter, to find housing. There are 107 families I asked them to pull from March 1st to May 1st, 107 families, 35% identify as white, 30 as Hispanic, and 25% are Black families. So there are 35% of this group of families experiencing homelessness who have presented to shelter or called the CES line. 35% of them are white. Over 50% of them are Black and Latinx Rhode Islanders. The average income of these families is $664 a month, with 8 of these families having no income whatsoever. Like, this is something that was a problem before, and COVID, much like homelessness, just is going to exacerbate these disparities. And so it is really, really important that we win these funds, that we win these resources at the federal level, because, I mean, Rhode Island is not alone in having that enormous, enormous budget deficit. Many, many states do. But it's not even about the money itself, it's about what the money represents, right? Because how many times have we heard elected officials say, oh, we can't give you this funds, we can't pass these bills, we can't raise the minimum wage, we can't do this, we can't do this because of deficits, right? I mean, it's a great cover to try to ram through a lot of bad policy and to justify a lot of cuts and to justify not providing what families experiencing homelessness in Rhode Island need.
Christina,
So, yes.
this is amazing. And I just want to say thank you. And I feel like you have just put the exclamation mark on so many important
I have just
points.
one
Please, yeah.
Very quick sentence to say. Great. I'm so sorry.
Okay.
I appreciate everybody giving me their attention and consideration. But what I was about to say is you can make a difference here. You can make an impact, and you can do that by taking action and calling your congressional representatives, calling your federal delegation members, and asking them to support those resources and funds in the HEROES Act. And I'm not going to try to share my screen. Oh, wait, maybe I can. Here is a handy call to action that I have put together that hopefully everyone can see. I also have this in Spanish, and I can send this to folks afterwards. But it's a simple message. Call, say your name, say what town you're from, and I'm urging you to keep fighting for neighbors experiencing homelessness and low-income renters. The 3 big asks, again, $11.5 billion in ESG, $100 billion in rental assistance funding, national uniform moratorium on evictions and foreclosures. And I have included here, if you don't know your federal delegation's phone number, you can also email them, but a phone call is always great. You can call the US Senate switchboard or the US House switchboard, and the operator will connect you right away to your representative. But call, get a friend to call. This is how we make change. We started with nothing in this stimulus package, and now there's $175 billion for housing and homelessness. And it all is because of advocacy. So keep it up. Thank you very much. I really appreciate
Oh.
being able to speak with you all today. It's been a fantastic conference.
Christina, thank you. Thank you for not letting me stop you. And thank you for rolling with me even after you might have observed me start talking with Solomon and then accidentally turn off my camera, which must have been alienating for my first colleague, and then accidentally mute Emily right after I asked her to speak. So let's just say you and I have a special relationship on this last panel because none of that happened. So why did MLPB bring all of these folks together representing, frankly, the kinds of ideas and huge important thinking that could consume us for a year-long retreat, let alone a 90-minute Zoom meeting? Because public interest law, civil rights law, environmental justice law is a common language, or needs to become a more common language that can thread together all of the different goals and increase proficiency across people way beyond the legal profession as we try to move closer to justice, greater access to justice, to use Emily's phrase, and greater health equity. And so we at MLPB are your honored partners, whether it is joining the table that was set by Children's Health Watch in Housing RX, the Housing Prescriptions Innovation. We are your honored partners to come to the table to help build that toolbox, expand that toolbox, and bring civil rights knowledge, public interest law concepts and language to those teams, to those initiatives, whether it's Vital Village design processes, trying to think about how to give voice and create frameworks for community priorities and data sets that matter to communities. We are part of a process with you of realigning tragically disaligned systems and structures. And we're really honored to be working with you in this way. And we are really honored that in ways that Christina just described so eloquently, together we can move closer to where access to justice and the common language of access to justice and understanding of civil rights laws and families' legal risks, rights, and legal protections more practically belongs to all of us, not just to the legal profession, which gave me my professional start. So thank you all. We know that there's a lot to reflect on, to think about, to follow up with this group on. And I can just say with confidence, there's no way that this is the end of the conversation. We will be reconvening in ways that make sense and are informed by your feedback. So with that, happy Wednesday, happy spring, and thank you for this rich dialogue and conversation.
Thank you.
Thank you.